Hey future nurses, today we're discussing thyroid wars. Hypo versus hyperthyroidism. Opposite problems, totally different vibes. So what does the thyroid gland even do? It's our body's metabolism regulator. It helps with growth and production, especially in children. It also produces our T3 and T4, which is responsible for many body functions such as heart rate, energy level, body temperature, and brain function. So think, if it's underactive, it's hypo. If it's on overdrive, it's hyper. So think, hypo is slow and low. Hyper is high and hot. So let's discuss signs and symptoms. For hypothyroidism, you will see weight gain because your metabolism is starting to slow down. So you're going to have weight gain, weakness, low temperature, low heart rate, low level of consciousness, slow speech, receding hairline, constipation because not only does everything slow down, but peristalsis slows down, and depression and cardiac problems. With hyperthyroidism, everything is going so fast, your metabolism is moving fast, so therefore you are going to lose weight. You're going to have intolerance to heat, elevated systolic blood pressure, elevated heart rate, anxiety, diarrhea, localized edema, bulging eyes, and also a goiter. Now let's talk labs. In your labs for hypo, you'll see a low T3 and T4 level, but you'll see an elevated TSH level, which stands for thyroid stimulating hormone. It's high because our pituitary gland is trying to compensate. You'll also see high cholesterol, anemia, and slow deep tendon reflex. In hyperthyroidism, you'll have an elevated T3 and T4, but you'll have a decrease in your TSH level, low because it has a negative feedback loop. But you'll also see high blood pressure and tremors. So do you need help remembering treatment? I've got you. When you think of hypo, you think slow and low. Levothyroxine, also known as Synthroid. Take this medication every day at the same time on an empty stomach. But always make sure you monitor for overcorrection because then you can send your patient in the opposite direction. But when you think of hyperthyroidism, everything is high and hot. So slow it down. We're going to give anti-thyroid medications like methimazole and PTU. We can also do radioactive iodine to destroy the thyroid tissue. We can also give medications like propranolol, our beta blocker, to treat things like anxiety and tachycardia. We can also do a thyroidectomy, which will remove the thyroid gland altogether, but remember, then the patient needs replacement for the rest of their lives. So with both hypo and hyperthyroidism, you can go into a crisis. With hypothyroidism, you can go into something called myxedema coma. It is rare but life-threatening. The patient becomes hypothermic and unconscious. With hyperthyroidism, you can have something called thyroid storm. Think the acronym HOT. Hyperthermic, overstimulated, high blood pressure, and tachycardic. It's life-threatening. The patient needs ICU. So hypo is cold, slow, tired, and heavy. Hyper is hot, fast, anxious, and skinny. Same gland, different direction. So if you know the signs, symptoms, and meds, you'll ace this exam. So hit like, comment, and subscribe. Happy studying.